Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi.
Today we will discuss on a special topic on management of pain in animals with our expert Dr. Deepa Katyal, who is a leading veterinarian practitioner in Mumbai. Her international exposure includes working with the legendary Australian wildlife expert and conservationist Steve Irwin. In the course of her 2-decade career, she has been involved with many animals' welfare and animal rights organizations in various capacities. Her selfless work towards treatment of stray animals and fostering accident and trauma cases, both wild and domestic animals, is well known. She is also one of the very few veterinarians management in animals. After completing NAVC Institute Pain Management Program, she practiced pain management using acupuncture needle stents and cold laser warding the pain of many animals effectively, and the results were satisfying. She has certified herself in acupuncture in a masterclass from Cura Core Academy, US. She has been practicing acupuncture now for more than a decade. She is the only vet from India to give a TED Talk on pain-related issues. She is one of the very few veterinarians offering physiotherapy and rehabilitation service in her city. She reintroduced the concept of wheel carts and mobility harnesses, which improves the lives of paralyzed patients as well as their human companions. She plans to get more deeply involved in the subject and be able to help more immobile animals get back on their feet, or at least be free of pain and have a better quality of life. She is an ex-board of directors for the International Veterinary Academy of Pain Management, USA. Her association with various voluntary organizations such as PETA, RAW, TSPCA, including several other such organizations, spans over a decade and a half. Hello doctor, welcome to a podcast for patients, caregivers and healthcare professionals at Medica Talks. How can a dog owner recognize pain in his or her dogs or cats?
The most obvious way of observing an animal in pain by the dog owners or people when they complain to us is observation of subtle signs. So maybe like the dog has a particular behavior, or the cat has, or the animal has a particular behavior, and that behavior pattern from morning to evening, just like how we human beings have behavior patterns, and we could behave differently when we are in pain or discomfort. Similarly, so these animals also can show change in their behavior patterns. Like suddenly a cat who loves, being outdoor and chasing butterflies or chasing insects or whatever, outdoors, would be more indoors, or perhaps if it's the time, it's early in the morning where generally the animals like to step outside and bask in the sun, and you will have the same animal like sitting in a corner, or curled up and sitting in a corner. So that could be like a change in a behavior pattern of an animal. Also change in body postures.
As a vet doctor, how do you handle such cases and help in easing and combating pain in dogs or cats?
So, as a vet, you have to be on top of understanding pain and recognizing pain in animals. And therefore, it's extremely, extremely important to, take detailed history from your pet parents to observe any pattern changes in the life of the pet. Like I mentioned, that they can actually stop their regular pattern and their behavior changes. Then also, what could be best could be your own hands, your visual skills in observing the animal. So palpation generally by far is the best giveaway, and one has to be very, very adept in understanding the individual animals, the temperament of the animal, and how does the animal behave generally. So it's best if you would have known the patient for a long time, because sometimes you just know that a dog is generally a very compliant patient and will allow you touching and petting and examination. But some of these dogs, when they are in pain, for a veterinarian, they can just suddenly bite you.
What would be the process in medical management?
The process of medical pain management includes oral drugs, which are to be administered either injectable or orally. And the other way of doing medical pain management is application of rubefacins, analgesic ointments, which are available, which generally a lot of people use for their back pain, for knee pain and arthritis, oils. And in India, we also believe a lot in alternative, Ayurveda is there. So Ayurvedic oils are also very popular in India, and a lot of people use that for medical pain management in case of joint pains because of joint diseases. Well, coming back to the medical pain management of the oral pharmaceutical drugs that are available, we namely use two kinds of painkillers, or let's say pain management drugs. One of them is the typical NSAIDs, or the non-steroidal anti-inflammatory drugs. And the other one is opioids. But to be able to understand how their mechanism of action is, or what happens, we first need to understand what happens when there is pain. So to be able to understand how the painkillers or the medical pain management works with the help of drugs primarily, we have to understand that what is the mechanism of action of the pain or the process of pain. How does it start? So pain basically starts at the source of an injury or inflammation. So whether it's your toe that is hurting, or your lower back, or if you injure yourself, there is a body's automated response to stimulate pain receptors. These receptors in turn release chemicals which are known as prostaglandins. These chemicals carry the message that it hurts to the spinal cord. The spinal cord carries the pain message from those receptors all the way to the brain, where it is received by the thalamus. So there is a part in the brain called as the thalamus, which sends the signal to the cerebral cortex, another part in the brain. And that part of the brain is where it processes the message. In other words, the message from this injury travels from where you're hurting directly to your brain, which registers the sensation known as pain. Then your brain perceives that pain and sends the pain message back to the area of your body that was injured or it was hurting. So the medical pain management includes two primary drugs, the NSAIDs, or the non-steroidal anti-inflammatory drugs. These are generally used to block acute pain, or pain that is just occurred, maybe like a headache or an injury or whatever. So how does this work? Basically, the drug that you take, which is a non-steroidal anti-inflammatory, just to cite an example, most popularly used crocin and all. These are examples of crocin, brufen. All these are examples of human NSAIDs. These basically block enzymes which play a key role in making the prostaglandins. So we know that these prostaglandins are any damaged tissue will release these prostaglandins, which are responsible for the pain pathway or the pain process. So these NSAIDs block the enzymes that play a key role in manufacturing or making these prostaglandins, and hence they cause pain relief, because if the enzymes get blocked, prostaglandins will not be produced, and if prostaglandins are not produced, then the inflammation or pain process is not completed, and it then thus gives us pain relief. So opioids are basically a broad group of pain relieving drugs that actually work with interacting with opioid receptors in our cells. So opioids are generally made from that poppy plant, which is a plant extract. Example like morphine, or it can also be synthesized in a laboratory. And some examples probably are the fentanyl drug that we use, which is an opioid for pain relief. Now, when opioid medication travels through your bloodstream and attaches itself to opioid receptors in your brain, like I mentioned before, that the spinal cord, the messages of pain which come from the injured place to your spinal cord, to from the spinal cord to the brain, and here is where the opioid receptors actually attach to, and the cells release signals that muffle your perception of pain and boost the feeling of pleasure. So basically, it not only causes pain relief, but it also changes your mood. And that's why also these medicines, opioids, are pretty dangerous. And see, in when I mean it's dangerous in lower dose, the opioids generally can make you a little sleepy. They can make you a little drowsy. That's why generally when we take these opioids as painkillers for chronic pain, we are advised not to drive our cars because it can actually have an effect of drowsiness on that individual who's taking the medicine. And even worse, when it's used for chronic pain, generally it can lead to addiction because constantly you feel the need to take those medicines, and then it can get into an addiction. And these drugs are also known to reduce blood pressure and can alter your heart rate. So one has to be very careful when they are kept on these kind of drugs for pain management, and especially like I said that they are used for chronic pain more than acute pain.
What would be the process in integrated management?
Let's see, an easy way to view integrated pain management is through the lens of the well known phrase, the whole is greater than the sum of its parts. So instead of traditionally treating the symptom, which is the regular approach to medicine, integrated pain management seeks to develop healing or treating options matched to the patient's comfort level. This empowers the patient to become an active participant in his or her pain management. But in our case, instead of making the patient an active part, obviously, I'll walk you through how the patient will also become an active part in the pain management in the case of pets. But here we involve the patient's family or the pet, the caregiver of the pet actively into this program. So basically, in broader sense, integrated pain management creates a collaborative relationship between the patient, in our case, veterinarians, the pet, his family, the other healthcare providers here, it could be a domestic help or etc. Therefore, integrated pain management is an integral part of long-term care program or for chronic pain management. It's one of the best solutions that will give you the best outcome. Though the patient may look healthy from the outside, but these pets generally suffer, especially the ones with chronic pain. They endure great deal of discomfort and physical exertion, even just to get up, leave alone walking, climbing, or jumping heights. For them, it's a big factor to sit down and then even get up. It kind of brings about a lot of hurts, especially with patients with chronic arthritis or disc diseases, things like that. For many pets, this chronic pain sources becomes a mystery where it's originating from, and several other factors that are attached to understanding the chronic pain in the patients. It also makes it's difficult for traditional line of medicine to help achieve a level of normalcy and, like I said, day-to-day functioning of their normal lives. But depending on the medical history and severity of pain, a patient's integrated pain management program could consist of several different treatment approaches. We generally use laser technology or photobiomodulation, which is also light therapy in simple language. We add acupuncture, transelectric nerve stimulation, medical massages, and physical therapies, hydrotherapy, whatever is available. All these things can be pooled together, and thus it's called integrated management. And this doesn't end here. We also educate the pet parents to do things at home. Like I teach my patients massage techniques or even games which help the patient develop certain muscles, because in case of human beings, you can tell them to do physical exercises which will help enhance muscles of certain body parts. That doesn't actually happen in our pets, like naturally, because we cannot teach pets to do certain kind of exercises. So what we generally tell is that the pet parents understand this, and they get maybe like pay a tug of war to develop back leg muscles of the dogs, and so on and so forth. So what happens here is you're providing continuous therapy, and it involves all the parties, the pet, the caregiver, the house help, as well as the clinic staff. So they play an active role in identifying, addressing, and resolving the patient's pain, that too in constant continuity, because it doesn't stop only in the clinical surroundings. It also goes back home with the patient. And this provides a greater successful outcome for chronic pain management. Therefore, integrated pain management is actually more sorted out for chronic pain patients, and definitely has greater outcomes than regular pain management.
What are the non-pharmacological modalities for pain management?
So the non-pharmacological modalities for pain management basically include photobiomodulation or light therapy or cold laser. There are multiple names. Essentially using light to cure pain. Then there is transelectric nerve stimulation or TENS. We have acupuncture also that we use, which is also like dry needle therapy. Then there are physical therapies such as medical massages and shockwave therapies that are very popular overseas than in India, for at least for animals.
How does laser therapy help?
So the therapeutic lasers that are available to treat pain and tissue injuries, everything depends on the wavelength of these gadgets. So if an equipment is delivering 980 watts, that particular gadget can easily be used to treat nerve injuries, or mostly popularly going to be used for pain. On the other hand, those lasers which have wavelength of less than 600 watts, those can come in the category of cold laser and are mostly used for tissue healing.
Well, one thing I can assure our listeners that this podcast is going to be one of the most interesting podcasts of Medica Talks. We are in conversation with our expert Dr. Deepa Katyal, who has a lot more to share about pain management in animals. We shall wait for our next episode at Medica Talks to gain more insights from the veterinary industry. Thank you, listeners.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.